All right. Hi, everyone. My name is Dr. Dan Choi. I am an orthopedic surgeon in Long Island, New York. And and I'm also the Young Physician Section Chair of the Medical Society of the State of New York, also known as MSSNY. And today we have a webinar of medical students, residents, and young attendings, some of who are on the front lines of COVID-19 care. And we have students and doctors from all across the state, from downstate in the Queens, Manhattan region, all the way up to upstate as well. So we'll be hearing different perspectives. Joining us today are past president of MSSNY, Dr. Tom Madejski. We also have the current Young Physician Section Chair, Carlos Zapata, who is also a residency program director, as well as the current Young Physician Section Counselor of MSSNY. We also have the Vice Chair of the Young Physician Section of MSSNY, Dr. Jocelyn Young, who is a family medicine physician attending. And then we have Dr. Charles Lopresto. He is the current resident fellow section chair of MSSNY. And we also have two medical students joining us. We have a third-year medical student, Shireen Saxena, who is the current medical student section counselor of MSSNY, as well as the past medical student section chair. We also have Jess, Hubert, who is a second-year medical student, who is the current medical student section chair of MSSNY as well. Welcome, everyone. Thank you guys all for joining us today on a Sunday afternoon. I know you guys have lots of other things that you can be doing with your time. So hopefully we can get some very key points going on. I first wanted to start off with our young physicians who are on the front lines and taking care of COVID patients. And I know I've been touching base with them occasionally about the surge that's happening in New York and how hospital capacity at sometimes have been overwhelmed, especially here in the downstate area. So I want to start with Dr. Zapata. How have things been going? How was the surge for you at your hospital, and how are things now, and any issues that you want to bring up that are relevant to the care of COVID patients?
Thanks, Dan. So I'm an emergency physician. I've been on the front lines of this pretty much since the beginning. I work in Queens and Nassau counties downstate, so I really got to see everything from the front lines from the get-go. And what we noticed was there was a huge surge in patients coming in just about a month ago, right around the same time that Governor Cuomo put New York State on pause. There were literally lines out the door. I could see going down like one block in Queens where we had lines out the door, people waiting to get into the ER just to be checked out. Most of them luckily were just worried well. We were very overwhelmed with the amount of patients. There wasn't enough space in the emergency department to be able to see everybody, let alone spread them out to prevent them from transmitting COVID to other people who were in the ER. The inpatient teams were getting hammered with multiple admissions for people that required oxygen or other kind of supportive care to treat them. It was quite a mess. I was very lucky that I narrowly managed to avoid running out of ventilators at the very beginning. I think it was about right around the end of March. I was there at a time where I had 3 patients that I thought were probably going to go into acute respiratory failure, need a ventilator, and only 1 available in the ER. So I had to do my best, try to run around and try to titrate the oxygen, put them on oxygen with high flow, try to take a chance on CPAP with 1 to see if that would work, because even though that still increased the contagion. So that was a big challenge. Luckily, in the past couple of weeks, things have kind of really stabilized down here, to the point where the emergency department we actually have lower amount of patients now than we did before COVID. And I think that's because a lot of people are afraid to come to the hospital because they're afraid they're going to get that just by coming to the hospital, they're going to be exposed to the coronavirus and possibly get sick or die from it. And I'm actually really concerned that a lot of the patients that I would normally see in the ER for substance use disorder, for heart attacks, for strokes, and for trauma are just like ignoring their symptoms, not coming in. And it's really, I think it's going to be a really big public health concern we're going to see coming up in the next couple of weeks.
Well, thank you for your service on the front lines, Carlos. I know that it's not an easy environment to be in, and we appreciate everything you're doing for our patients there. Dr. Jocelyn Young, can you share with us if there's any what's going on in the upstate region, and just what area are you also working here?
Sure, I'm a family doctor up in the Binghamton area, upstate. We're seeing a little bit different of a situation. We didn't have that big surge that New York City had, which we consider ourselves very lucky to have not had. And instead, we're seeing more of a persistent level of patients coming in. But like Dr. Zapata said, we're having the same issue. There's lower numbers of our other patients in the ERs, in the hospitals, and in our clinics. And as a family doctor, I've mostly converted to telehealth, which has been a really great adventure. But there's a lot of my patients that have uncontrolled diabetes, hypertension, all these different things that are kind of getting lost in the fray, or don't have internet, or all those kinds of problems. So I agree, there is going to be a big public health thing at the end. The other thing that I would say is that we all share the same kind of PPE concerns. And so we've done some different things, like a rotation of attendings that are covering the hospital. So instead of the residents seeing those potential COVID patients, the attendings are seeing them instead. So I've been part of that rotation and learning how to do night coverage and all those things, again, that I haven't done since residency.
Wow. Is there any feeling that the hospitals and ICU capacities in the upstate region are overwhelmed at this point? Or is there any signs that cases are increasing and going to approach that limit? Or do you think that kind of the surge is on its way down in the upstate region from what you've heard?
Our numbers are still going up, but not by huge amounts. And our conversation has turned a little bit less away from what do we do with a surge that we can't handle, and how do we manage the persistent levels? So we think our modeling might have changed enough to say that we're not going to get overrun, we hope.
Yeah, Dan, we've had sort of similar numbers, although Erie County still, I think, was not one of the areas that was felt there would be a beginning of a relaxation, because the numbers are still trending upward. Capacity's been okay. PPE has been reasonably good as well. The other phenomenon that we're seeing here, which I think is happening other places, is nursing home surges. There's a nursing home that I'm a medical director of where we have a fairly big outbreak, and that has been a challenge. The relatively good news is for most of them, it's been, relatively low intensity illness or asymptomatic. But we have had some people who've gotten sick and passed. I would say that most of those people are the people we would expect to have passed with any, significant acute illness if we had an influenza outbreak, whatever. And I think one of the key things moving forward, again, for all of our primary care specialties is those discussions about advanced directives. And I think that was sort of key in us helping to, try and not overwhelm emergency rooms in our local area.
That was very helpful in our state when we had people that came into the ED with advanced directives. That was very helpful for us, because then we could have a way of knowing what the patient would wanted, even though they weren't able to tell us, and we were able to honor those wishes and help to conserve some resources at the very beginning we had the surge.
Yeah, the nursing home situation across the country is unfortunately a big mess. I think the latest statistic that I heard this weekend was 1 in 10 nursing homes in America now has a COVID-19 infection, and so or an outbreak within the facility, and it spreads like wildfire, right? Everyone's in close proximity. The patients often need help from nursing aides moving from the bed to a chair or whatnot, and it's just no way to effectively social distance in those facilities. So it's a big issue. I have heard Governor Cuomo speak about it often in his press conferences. So we hope that the appropriate attention is being brought and appropriate resources. Let's move on to our resident physician, Dr. Charlie Lopresto, who has been on frontline care in his hospital, and he has been sharing with me lots of issues that have been going on. So, Dr. Lopresto, can you share with us your experiences, please?
Yeah, so I'm an internal medicine physician, also in Queens. So I saw a lot of the surge and a lot of the uptick in the coronavirus cases. At our institution, we are normally about a 25-bed ICU capacity, and I had the pleasure to serve in the ICU during this time. Our census went up to about 80 at some points. So finding ventilators, finding PPE, finding appropriate staffing, making sure the appropriate care was rendered was some of the biggest challenges in terms of organization. And from the resident perspective, I think, we have had to do a lot of acrobatics in terms of rearranging our schedules, making sure we have adequate coverage. And a lot of us after this surge and still ongoing, we're struggling with a lot of fatigue and, trying to protect ourselves going forward from some issues such as, PTSD maybe in the future, seeing a lot of unnecessary patient deaths. So I think overall, it's been a big stress on the resident and fellow community.
Now, is there anything that you think right now? I know that there's been some talk about residents and fellows. One of my concerns, personally, when I saw this, is that I went through residency not too long ago, and it's a time when you're under tremendous stress, duress, just because you're working long hours. And then secondly, you're kind of at the lowest point of your kind of economic situation, right? So your net worth is lowest. You've just graduated with hundreds of thousands of dollars of student debt. You're making almost just above minimum wage for the hours that you're putting in. But we willingly do it because we know that this is what we signed up for, and we're getting this education to help our patients for the rest of our lives. But it's a little different when you suddenly throw in the scenario where you're staring death in the face, and every time you go into the hospital now to do your duties, you may be exposing yourself, or you're putting yourself at risk and your family is at risk. And so I've been concerned that, should a resident pass away or from this exposure, they may be leaving their spouse with a tremendous amount of student debt, and especially if they have private loans. So I just wanted to see if there's any talk, what your thoughts on that are, and what you think that our elected officials should be paying attention to in terms of that situation.
Right. I'm glad you brought all this up, Dan, because this is one of the biggest questions going forward in terms of how New York State or how the nation will address some of these issues regarding how to adequately protect and also compensate our frontline workers, especially the resident physicians, who are, as you stated, some of the least capable of advocating for themselves in our current system. So some of the talk that I've been seeing going on at different institutions has been about hazard pay. And this is sort of an institution by institution approach right now. However, my personal thoughts on it are that I think this has to come from a state or a national level going forward. And there's been a few large medical organizations and also politicians who's released guidelines going forward regarding some of these ideas. For instance, the American Medical Association released on April 15th, co-signed by 141 specialty state and national medical societies, a letter to Congress with the following recommendations. They said that for residents and early graduated medical students whose debts averages over $200,000, we urge Congress to provide at least $20,000 of federal student loan forgiveness or $20,000 of tuition relief. So there are talks about, tuition or loan forgiveness. I think these would be greatly, appreciated by our frontline workers and residents. I think Dan brought it up here.
Here we go, right here.
Yeah, I'd like to go back out of the full screen.
I can get out of there for you. Okay, I brought it up. So
here we go. Yeah, so that's the so far the recommendation from the AMA regarding loan forgiveness. Regarding hazard pay, this has been a little bit more of a tricky issue. As I said before, it's sort of institution by institution. The best evidence I've seen so far for a more national approach has been the COVID-19 Heroes Fund, which was put forth on April 7th by the Senate Democrats. And their recommendation regarding hazard pay is to provide $13 an hour premium pay in addition to regular wages for essential workers. This would be capped at $25,000 for workers earning less than $200,000 a year, and capped at $5,000 for those earning $200,000 or more per year. Importantly, this proposal would be retroactive from January 27th, 2020, and it would go forward to December 31st. So for the resident physicians and fellows who make well under $200,000 a year, getting a national hazard pay recommendation along those lines would be very helpful.
Absolutely. Thank you so much, Charlie. Appreciate you sharing that perspective. I wanted to move on next to our medical student.
Dan, if I could just make
Yes.
one comment there. So yeah, so MSSNY's been working on that. We were one of the sign-ons on that letter, and we're looking for other options. And I think the hazard pay is critical, but I'm really concerned about, those of our physicians who have lost their lives. And we were trying to come up with some mechanisms to compensate them. And we continue to work on that. And I wanted to bring to the group's attention, the Metropolitan Transit Authority has come up with a way to compensate their workers who have passed. The MTA's had 83 people pass on. And they gave us some numbers and sort of at least building a framework to compensate people who truly made the ultimate sacrifice in the care of their patients. And I think that's really something important for us to move forward at MSSNY and the AMA. So this was recently in the Wall Street Journal. There was a $500,000 death benefit provided to beneficiaries, and they ensured that they had health insurance for 3 years to allow, a family to have some transition. So I'm not sure what the right mix is for us and for all healthcare workers, not just physicians. But I think, this is sort of a starting point for a discussion, and I think this is really something that has to happen.
Absolutely. Thanks for bringing up that point, Tom. I think that, this is not about doctors, just kind of, saying, demanding greater pay or anything like that. It's just, we're putting ourselves in harm's way, and we want to protect our families, economically. If we were to, the worst situation I can imagine is one of us, being about to be intubated, not knowing whether we're going to wake up again, and then thinking about, oh, I'm leaving my spouse with $200,000 of debt, and that's going to be my legacy to my family, and that's just a horrible situation to be in. So I really hope that we continue to bring more attention to this and really push for the adequate economic protections for our families. We want to move on to our medical students now. I know medical student, when I was in medical school, it was a pretty stressful time. There's a million things on your plate at all times. Honestly, it was tough. I think that in the many aspects, medical school was tougher than attending life or residency or fellowship, because you're juggling so many different things, and there's a high pressure situation, especially with the USMLE STEP exams. And so I know that we have Jess, Shireen says, Jess is a second year student and Shireen is a third year student. And recently, I believe the medical students took a statewide survey in New York to get kind of like a feel for what's going on with students right now in the middle of this crisis. So Jess and Shireen, can you guys share the results of the surveys and what you think that means for the body of medicine and what we need to do for students going forward?
Yeah, thank you, Dan. So I think as an MSS, we came together with the goal of encapsulating what the student perspective on the current status of medical education and national board exams has become. So our survey was designed to do just that. We circulated it around medical students within the state of New York The results of the survey so far have been pretty revealing, because what many of us believe to be kind of outlying circumstances are starting to seem like they're more and more the norm for medical students trying to be full-time medical students from home right now under a stay-in-shelter order. So for instance, a few of the things I'd like to share just that came through the survey, we have nearly 89% of students that responded that said they're feeling more stressed or anxious than usual, maintaining their current responsibilities as medical students during the COVID-19 pandemic. A majority of students also felt that they will not be able to maintain, let alone improve their performance compared to last semester. And then almost 70% of students have also reported that this pandemic has interfered with their ability to prepare for national exams, including Step 1, Step 2, and shelf exams, compared to what they would have been able to do otherwise. I think one of the things that became very revealing are we had a section for comments at the bottom of the survey where students could write a little bit about their specific situations. And we were seeing a number of issues among students, including being infected themselves and recovering, having a loved one be infected and taking care of ill family members, childcare, new financial instability. And I think as more and more research is being done, we're seeing that the burden of this pandemic and its negative effects are not proportionally distributed across different populations. And so there's a disproportionate burden that's falling on low socioeconomic status communities. And so that includes many of our medical students who come from low socioeconomic status backgrounds. So those who come from those backgrounds are more likely to be disadvantaged during this time. A few examples: they're more likely to have parents or spouses whose jobs are considered essential and are therefore facing increased risk every day. They're more likely to have parents or spouses who lose their jobs as a result of this pandemic. They're more likely to be impacted severely if a parent or a spouse does lose their job. And so I think these are things that need to be considered, especially when you're thinking about national examinations like step 1 and step 2. They're designed to create a level playing field so students can showcase their ability regardless of which institution they're coming from. And yet what we're seeing is that at this time, it's not really a level playing field. And so for the medical educational system to kind of acknowledge that and provide clear communication about expectations moving forward, how they will support medical students, and make sure that these unfair burdens don't then impact our ability to move on to next steps within medical education and impact the kind of residency we'll have as future physicians.
All right, thank you for that, Shireen. Shireen really did cover the largest gist of the survey. Something that I found interesting, again, from that section where we had people write in their own answers, is that there's right now this moral conflict that a lot of students are unfortunately being forced into. And that moral conflict is, well, as a medical student, no matter what year you are, you have accumulated some knowledge and some skill set that you feel would be helpful in the front lines of this current COVID-19 pandemic. And we're caught between a rock and a hard place because we're put in the situation of, well, do I go out and do I use my knowledge and my skill set to help my hospital, to help the physicians to go out onto the front lines and help patients who are currently overwhelming many of the hospital systems, as we just heard, was recently and still the case in New York? Or do I stay in and do I continue to study for these exams that are coming up, which are going to determine, the types of residency programs I go into or where I can do my residency program? These exams that really have a huge impact on your medical career from this point moving forward. And so it's really unfortunate what we're seeing. And that's what a lot of these comments were saying, is students are being put in this hard situation where they feel that they're going to be penalized or punished for going to the front lines or in any way trying to help the current overwhelming COVID-19 situation, and that the way that they will be punished is that they won't get the same grade on these standardized tests, or that their institutions or the USMLE or whatever third party have you won't be as understanding of their decision to use their time and use their skill set to help, and that they will instead be punished for not staying inside and not committing all of their time to studying. And so that was something that was really interesting and really sad also that came out of these responses. And so a second thing I wanted to say that came out of these responses is, I think while COVID itself is bringing a lot of stress and anxiety to students at this time, understandably, something else that's bringing a lot of stress is that there seems to be a lack of clarity moving forward from both individual institutions and from larger bodies such as Prometrics or USMLE on how they're going to handle testing moving forward and how they're going to handle people who are unable to test at this time, and what the consequences are going to be, negative or otherwise. And so, as Shireen was saying, I think something that could really help the medical students at this time, and I understand it's hard, it's a nuanced, unprecedented situation. Not everyone is going to have answers at every turn, but something that I would encourage and that I would challenge everyone to do is to really think about how we can be transparent and open communication with medical students. There doesn't seem to be a lot of communication at multiple levels about, you know, what happens if my test has gotten canceled. Many students have already had their tests canceled. You know, what happens if I haven't taken my test by the time it's time for me to start third year? You know, what are the testing centers going to look like if we are implementing social distancing measures while taking the test? And so that's something that I would challenge everyone to think about at this time, because I think that based on our answers, that's another source of anxiety and stress for students, just not knowing what the future holds and, you know, what consequences they're going to face for making certain decisions at this time.
So I would have a couple questions for Shireen and Jess. And I agree, it's a nuanced and very challenging situation. And one of the difficulties is, you know, the effect that we're seeing in New York, particularly in New York City, compared to some other areas of the country, really makes it very difficult to do certain things in parts of New York. What do you guys have proposals for what you think would be a fair and effective way to advocate for our students? And I think there are other licensure examinations and other implications to people who are working postgraduate. Do you have any specific proposals that you think would be useful that we could advocate for? Shireen, you want to go?
Sure. So there are a couple of things that as a medical student section we've been discussing. One is clear communication from the NBME, NBOME, and Prometrics regarding cancellation of exam dates. I think this will go a long way in alleviating a lot of the stress and anxiety that med students are facing. If you think back to when you were studying for step 1, this is a 6 to 8 week, very intensive period of studying that leads up to the date of your exam. And we've had instances in which Prometric canceled exams 6 days before the actual exam. And so there are students that have been studying since February who are now scheduled to take their exams in July. And just imagine the kind of stress that, you know, you would have to be able to withstand in order to study with that intensity consistently and still not have the certainty that you really need. So that would be one, is just having some clear communication, at least 1 month notice for canceled exams, given the amount of intensity they have. I think another area that could be helpful is having flexibility on the part of medical education systems, so from our institutions as well, alleviating some of the burden of requirements. So Jess mentioned that there are many medical schools that require second years to take step 1 before they can progress into third year. So one of the solutions that students have talked about include postponing this requirement to taking step 1 by the end of third year. And for second year students, or third year students, excuse me, they may need more time to prepare for step 2 exams in a similar fashion. Another thing which could be controversial, and so we are asking for just a second look at the possibility of this solution. Step 1 is scheduled to become pass-fail in a couple of years. And there's been some discussion whether this might be an appropriate measure right now, since students are facing different levels of stress and barriers trying to prepare for the exams. Perhaps making the exam pass-fail would be a way to help to level the playing field just during the current circumstances. But naturally, this would take a little bit more consideration and just deliberation.
Yeah, I think piggybacking off of this, I think the residents and fellows, we also have similar concerns regarding our education. It's often overlooked that, you know, while we are physicians and doing a lot of work in the hospitals, we're still, you know, in our education and developing our careers. And for a lot of us, especially who have been reallocated to different clinical duties outside of our normal scope of practice, you know, our careers have sort of been put on hold. you know, a lot of people have been missing out on specialty rotations, and especially our surgical colleagues who need to maintain their dexterity and maintain their level of, you know, performance to advance their career, especially going to possible subspecialties. A lot of these people are not going to have this time back. You know, so we're all at a loss in terms of any possible solutions going forward to recoup some of this time in terms of our education. We've seen some recommendations from ACGME in terms of relaxing some of the guidelines and allowing for you know, other not clinical duties that we wouldn't normally be doing to count toward our graduation requirements. And we've seen some specialty medical boards also relaxing requirements in terms of when exams can be taken. However, the point remains that, you know, some of our careers are sort of put on hold at this time in terms of advancing to our next steps after residency or fellowship.
Great. So thank you guys all for sharing your perspectives on what's affecting you most during this crisis. I know that there's a lot, you know, there's a lot of changing factors here, a lot of people under duress. And the only way we can make change happen is, number one, speaking out like you're doing now, making sure that you know, we broadcast those concerns and hopefully try to get those messages to the decision makers, right? So in your cases, it's your program directors, the NBME, the AMC, and then also we have our state and federal elected officials, and all of us who are involved in advocacy know that, you know, getting to those levels is sometimes like you know, climbing a very, very tall mountain. But you know, the first step starts here by getting the word out, and then try to build coalitions and try to get our, you know, state medical side. I know MSSNY is behind every single one of the medical students and residents and fellows in New York State, as well as the young attendings. I know that MSSNY as an organization is behind every single one of you and is actively working. And I know behind the scenes that they are actively working to protect your rights and your safety, and as well as the safety of our patients every single day. Dr. Madejski, do you have any closing remarks?
No, this is really helpful. We have a meeting of our leadership tomorrow. This is on our agenda. We're going to come forward with some other proposals, and we're going to continue to advocate through with our partners in the AMA and some of our other regional states. So again, as you identify things, you know, the door is always open. We want to hear from you. You guys are all leaders and counselors within MSSNY and at other organizations as well. And, you know, we need to hear from you so we can come up with what we need to do to move the profession forward, and make sure you have a place to practice when you're done with your training.
All right, guys. Okay, that sounds good. I'm going to go ahead and we're going to end this webinar, and thank you guys for joining us. Okay. All right, I stopped recording, but you guys can stay on real quick. If you guys want to stay on just for a quick discussion, I just stopped the recording. I'm going to stop this.
Dr. Rothberg, you joined us.
Yeah, I just got the email from Dan. I know he sent it at 10:30, and thank you. I just walked in the house because it started raining and saw it. I apologize. I'll have to look at it like I look at all your other good work. But I wanted to remind you